Choosing the right hair transplant technique at Vera Clinic, DHI versus Sapphire FUE. What is the DHI technique? DHI involves using a CHOI implanter pen to apply the hair follicles that have been gathered one at a time directly to the appropriate location. The opening channel is carried out concurrently with the transplantation process. An open channel will not be necessary for DHI. What is the Sapphire FUE technique? Blades with sapphire tips, which are incredibly sharp, are used to create channels. In Sapphire FUE, the channels can be naturally and often implanted following the direction of hair development. Differences between Sapphire FUE and DHI. In order to treat large alopecia areas where no hair grows, the Sapphire FUE technique is performed. The DHI technique is frequently applied to tiny areas with hair that is present but not dense. The DHI method offers a better chance of obtaining higher density, whereas the Sapphire FUE approach is best suited for broad areas. During a hair transplant, different procedures take different amounts of time to complete. While DHI lasts between 8 and 10 hours, Sapphire FUE lasts 6 to 8 hours. For Sapphire FUE, the hair must be shaved, but the DHI procedure does not require this. People who do not want to cut their hair might, therefore, prefer the DHI method. When employing the Sapphire FUE procedure, between 3,000 and 5,000 grafts can be planted per session.
It is possible to plant between 1,500 and up to 4,000 grafts during a DHI per session.
Compared to the DHI method, transplanted grafts had a greater survival rate. Compared to Sapphire FUE hair transplants, DHI hair transplant patients can recover more quickly. In summary, the DHI hair transplant technique is ideal for smaller areas with sparse hair, offering higher density and quicker recovery. In contrast, Sapphire FUE is better suited for larger alopecia areas and can transplant more grafts. The choice depends on individual needs and should be discussed with a specialist.